some, life seems to be returning to a relative form of normalcy. However, human beings inside the county jail are still facing deplorable conditions that have only been made worse through the COVID-19 pandemic. The sheriff has remained negligent throughout the years to enhance the very repugnant conditions that resulted in the lawsuit in which Sacramento County had to put the bill for.
My husband went into that facility with nothing other than severe anxiety, but now he has asthma. He has contracted COVID twice. He has COVID as we speak and is vaccinated, but still is sick due to his breathing problems.
Hi, Courtney Hansen with Decarcerate Sacramento, and I'm here to speak with other community members about a COVID-19 outbreak that is currently sweeping through Sacramento jails. And while the Sheriff's Department reports 0 COVID-related deaths, we know the SACB reported one yesterday from the 25th. We are hearing reports of a separate death of somebody who actually passed inside the jail and was found stiff dead in their cell on the 21st. It's time to read a statement from Jasmine Stevens, whose husband, William Francis Stevens, of 16 years, passed in the jail on February 16th. On a phone call before his death, he told her he had asked for basic medical attention, including information about his own condition, over 10 times in the jail with no response. On February 16th, my husband, William Francis Stevens, died in the Sacramento County Jail. The coroner is trying to say that my husband died from complications to his heart, which I feel is a complete lie. He died from COVID-19, which gave him complications with his heart. I know for a fact that my husband tested positive and he was not having his medical conditions met in that horrible place.
I would like to publicly ask for the Inspector General to once again look at this specific issue at the jail when it comes to COVID-19. I'd like to know specifically what the procedures for intake are, what the separation procedures are when an inmate is determined to test positive, what the tracing activities take place when that happens, and what the policy is for reporting deaths and COVID-related and other health-related data at the jail when it comes to inmates.
Potential second death is just about Phil.
All deaths.
Yeah, all deaths. I know we had the one that was basically reported yesterday, but Courtney's comments alluded to potentially a second one.
Well, yeah, and I've actually had a conversation with our county executive because I have been. It's not the first time I've heard that. I heard that as recently as last week.
Adult Correctional Health reported investigation of a COVID-19 outbreak at the jail facilities the week of October 18th. An inmate at RCCC who complained of symptoms was complaining of symptoms, and staff completed a rapid antigen test which was positive, and this led to widespread contact tracing, quarantine, and a large-scale testing in both jails. As of just this afternoon, late this afternoon, we were up to 191 cases of COVID in the jail since the outbreak. And not all of these are associated with the outbreak, but the majority are.
You said, through the chair, you said jail. That's just RCCC?
No, I apologize. So both. Okay. I'm talking both main jail and RCCC. Right. Yeah. Most inmates who get COVID-19 are asymptomatic, but we have seen more symptomatic patients during this current outbreak than we did during the last.
Is there anyone in custody is currently hospitalized due to COVID related symptoms? Not
at this time. There was another individual who did go to the emergency room and then returned back to the jail. The gentleman who was hospitalized did pass yesterday. That was our only other hospitalization.
In the prior outbreak, we also did have some people that needed to be assessed at the hospital, but I can't provide numbers on that.
Has anyone attempted to work with the courts to say, maybe to contain, in the interest of containing the outbreak, because of the nature of jails obviously is you're confining people, and oftentimes 2 to a cell. Maybe the best thing to keep the outbreak from growing any larger is to somehow work with some kind of release or home detention or something other than keeping them in an environment where you're more likely to have them continue to contaminate and infect others in the jail.
No, thank you. That's a Good question. And those decisions are really outside of correctional health's purview, under the district attorney and the sheriff's department purview.
Anything that could or should stop you from, or your staff, quite frankly, from at least asking what may be the right question to the, of the right group of people, namely the bench, to see if that is the best way to address further outbreaks. I understand it's not your call necessarily because it's in a correctional context, but if your charge is to obviously do what you can to contain spread of communicable disease, seems to me that we wouldn't want to be bashful at this time, and we'd want to have the right folks advocating or suggesting, at least, perhaps even directly to the courts, not just through the sheriff's department, the possibility of getting maybe some of the worst cases or those that are immunocompromised or elderly inmates, high-risk folks that perhaps aren't vaccinated, so perhaps they're more likely to have the very acute symptoms. It just seems to me that there's the possibility of doing that. So I'd like to understand that a little bit better.
And this is Dr. Olivia Katsiri speaking. I'll have to work with county council on that. We have not done it before because, as was mentioned, with the previous outbreak, there was already that provision to be able to release inmates early, but it's not the case now because that provision ended.